Hey there, fellow educators, and honestly, anyone who's ever wondered what would happen if we actually listened to teachers for once. I'm Leah Cleary, and this is If Teachers Ruled the World. You know, after 25 years in the classroom, I've learned that teaching isn't really about having all the answers. It's about being brave enough to ask the right questions, and maybe, just maybe, admitting when we have no idea what we're doing, which, let's be honest, happens more often than we'd like to admit. So grab your coffee, or whatever, and let's talk about the real stuff, the messy, imperfect, sometimes beautiful reality of what it's like to shape young minds while trying to keep our own sanity intact. Because if we're going to change the world, we might as well be honest about what that actually looks like. All right, let's dive in. Hey, teachers, it's time for your monthly Teacher Reality Check, where we translate education policy jargon into what it actually means for those of us in the classroom. Last month, I interviewed a fellow teacher about Medicare for All and how universal health care would benefit our students. And that conversation got me thinking about something I've really just taken for granted my entire teaching career. Why do my students show up to the classroom every day as a right, as an entitlement in the policy language, but when those same kids get sick, their access to a doctor depends entirely on whether their parents have the right job? These are the same kids, the same country, the same time period, but two completely different systems for two fundamental needs: education and healthcare. And what fascinates me is that it wasn't always obvious that it would turn out this way. So let me tell you a story that nobody mentions when they're teaching World War II in our classrooms. And trust me, I teach AP World History, I've taught U.S. history, I've spent some time on this war. But this never makes it into the textbook. It's 1942. America is fully engaged in World War II. The economy is running hot. We're producing war materials, men are being drafted, women are entering the workforce in unprecedented numbers, and the government is terrified. Not just of losing the war, they're terrified of inflation. See, they'd watched what happened to Germany after World War I. Inflation destroyed the Weimar Republic in Germany and helped give rise to Hitler's regime. So, the U.S. government passes the Stabilization Act of 1942. This law freezes wages. Companies literally cannot give their workers raises to compete for labor during this massive labor shortage. But here's where it gets interesting. According to historians at the Hill, this wage freeze had an exemption, a loophole. The law said insurance and pension benefits didn't count as wages. So what did companies do? They couldn't offer more money, so they started offering health insurance instead. And then in 1943, the IRS made a ruling that changed everything. They declared that employer-paid health insurance premiums weren't taxable income to employees. Suddenly, it was incredibly attractive for both employers and workers. The Chicago Tribune reports that in 1940, only 9.8% of Americans had health insurance. By 1946, it was 30%. By 1955, it was nearly 70% of the population. Healthcare got tied to employment by accident. As David Ballot from the Texas Public Policy Foundation puts it, and I love this phrase, this was an accident of history. Meanwhile, education took a completely different path, and that path started way earlier, even before we had a constitution. In 1785, that's 2 years before the Constitutional Convention ever met, the Continental Congress passed the Land Ordinance Act of 1785. According to the Center on Education Policy, this ordinance laid the actual groundwork for public education in America by doing something remarkable. It reserved Section 17 of every township, that's 1 square mile of land, specifically for the maintenance of public schools. Think about that. Before we even had the Constitution, before we had the Bill of Rights, before we even knew exactly what kind of country we were going to be, we were already setting aside land for public education. Then in 1787 came the Northwest Ordinance, and this is where the philosophical commitment gets explicit. The ordinance stated, religion, morality, and knowledge being necessary to good government and the happiness of mankind, schools and the means of education shall forever be encouraged. Forever be encouraged. That is some strong language. And according to Derek Black at the University of South Carolina Law School, these Northwest ordinances helped shape 31 states. They became the template for how America would expand westward, and education was built into that template from the very beginning. The Library of Congress notes that these ordinances are still reprinted today at the front of every copy of the United States Code, right alongside the Constitution and Declaration of Independence. That's how foundational they were. So by 1785, before we even had our current government, we'd already decided that land, literal physical land, would be dedicated to public schools. Education was not an afterthought. It wasn't something we get around to eventually. It was part of the plan for building this country. And then that commitment just kept building. After the Civil War, and this is from the Center on Education Policy, Southern states had to rewrite their constitutions as a condition for being readmitted into the Union. Those new constitutions established free education as a basic right for both races. It was written into the state laws as an entitlement. By the time the 14th Amendment was ratified, according to legal scholars Stephen Calabresi and Sarah Agudo, 36 out of 37 states already had some right to education written into their state constitutions. Horace Mann's Common School movement in 1837 had established the idea that education should be universal, not sectarian, and that it should be free. Massachusetts passed a compulsory attendance law in 1852. By 1870, all states had tax-subsidized elementary schools. The Purdue Global Law School explains that education became what they call a legitimate entitlement to a public education as a property right, protected under the 14th Amendment. So education became a public right, and not just recently, but going all the way back to 1785. Healthcare, on the other hand, became tied to private employment almost by accident during World War II. Two completely different paths in the same country, separated by about 160 years of history. And here's what I find fascinating about the difference. It comes down to how we framed these two things in our collective psyche. Education was framed as a public good, something where everybody benefits when everybody is educated. We need an educated citizenry for democracy to function, see? We need educated workers for the economy to grow. The whole society is better when all children go to school. That's the argument that won. But healthcare? Healthcare got framed as an individual responsibility. Your health is your personal business. Your body, your problem, your responsibility. And that framing won out again and again. The AMA Journal of Ethics documents how FDR proposed an economic Bill of Rights in 1944 that included the right to adequate medical care. It went nowhere. Truman proposed national health insurance in 1945. Congress called it a communist plot. The AMA denounced it. According to the Physicians for National Health program, the Wagner-Murray-Dingle bill for compulsory national health insurance was introduced in 1943 and then reintroduced every single session of Congress for 14 years. It never passed. Why? Western Washington University researchers point out that independence and individualism are hallmark American values that shaped healthcare policy. Opposition to universal health care claimed that welfare-style programs infringe on individual rights and freedoms. So, education became we all benefit when everyone is educated, and healthcare became individual health is individual responsibility. Now, let's bring this back to my classroom because this isn't just abstract policy history. This is my students' daily reality. I have students who show up to my class every single day because they have a right to be there. The state of Georgia has determined that education is an entitlement. Their family's income does not matter. Their parents' employment status does not matter. They are entitled to sit in my classroom. But that same student who has a legal right to learn about the causes of World War II from me, that kid might not have been to a dentist in 2 years because their parents' job doesn't offer dental insurance. I have students who come to school sick because their parents can't afford to miss work to take them to the doctor, or because they don't have insurance and urgent care is too expensive. I see students distracted, struggling to focus, dealing with untreated health conditions, not because their families don't care, but because healthcare access in this country is tied to employment. And a lot of families are one job loss away from losing everything. The West Journal of Medicine makes this comparison explicit. And I think it's worth quoting directly here. They write, let's see, like education, also in key ways, not a business, public health is a national investment. Could we justify a privatized educational system that denied access to slower learners unable to pay, the children who most need help? Ooh, could we? Could I stand in front of my classroom and say, well, if your parents can afford to pay, you get to learn. If they can't, you don't? We decided as a country that the answer to that question is no. But we made the opposite decision about healthcare. Now, here's where this gets really interesting, and it was a connection I hadn't made before. Maybe it has been made before, but as a teacher, it just jumped out at me. The doctors in 1915 were afraid of exactly what happened to teachers when education became a public entitlement. Let me tell you this story. In 1915, the American Association for Labor Legislation drafted a model bill for compulsory health insurance. This was the first major proposal for universal health care in America. And initially, this surprised me, the American Medical Association supported it. According to Physicians for a National Health program, AMA leaders actually wrote to the reformers saying, your plans are so entirely in line with our own that we want to be of every possible assistance. But by 1920, complete reversal. The AMA became forcefully opposed to compulsory health insurance. Why? According to Marketplace's reporting on this history, doctors opposed reform because they were concerned about income and they were concerned about autonomy. One physician wrote in 1917, and this quote is preserved in the National Library of Medical Archives, nowhere has the swinish greed of a debasing propaganda of state socialism been more brazenly exposed than it was in this merciless attempt to steal the livelihood of the most unselfish profession in the world. Dr. Micah Johnson, a physician and author of Medicare for All, A Citizen's Guide, calls doctors double agents in the health reform debate for the last century. He says doctors have worn two hats in these debates. the hat of medical experts, people who know a lot about what's best for patients. And we also wear a hat that's just our own personal financial interest. Johnson notes that throughout this history, doctors' top two concerns have been their own pay and their autonomy in the practice of medicine, with specific fears that universal public insurance would mean doctors would get paid less. And here's the thing, they weren't wrong to be concerned, because look at what has happened to teachers. We became a public service, education became an entitlement. Every child has the right to show up to my classroom. And what came of that? Well, I'll tell you what came with that. Teacher salaries that don't match comparable professions, increasing standardization that removes our professional judgment, policies made by people who've never taught, telling us exactly how to pace our curriculum, loss of autonomy over our own classrooms, diminished professional status. I mean, think about the difference in how society views teachers versus college professors, even though we're all educators, sometimes with comparable degrees. I'm not saying doctors were right to oppose universal health care. I'm really not. But I am saying they understood something about what happens when a profession becomes publicly funded and structured as an entitlement. They looked at teachers, they looked at other public servants, and they protected their professional interests. The AMA had the power, the lobbying power, the political power, the economic power to protect their profession. Teachers? But we didn't have the same power when our profession was being structured. And actually, there's another piece of this that's pretty fascinating. Labor unions also opposed the 1915 healthcare proposal. According to MedicareSupplement.com's timeline, the American Federation of Labor built heavy opposition to the AALL proposal because they feared, and I'm quoting, the program would weaken unions by undermining their role in providing social benefits. Think about that. Unions opposed universal health care because their power came from negotiating health benefits for their members. If the government just provided health care to everyone, what would workers need unions for? So unions had an incentive to keep health care tied to employment, and that's exactly what happened. After World War II, when employer-sponsored health insurance took off, unions were at the forefront of negotiating those benefits. Healthcare became a part of collective bargaining. But that meant the unions weren't pushing the government to create a universal system. They were pushing employers to provide better benefits to union members specifically. The PNHP research shows that attempts at universal health care in the U.S. failed repeatedly because of what they call opposition from doctors, labor, insurance companies, and business, combined with red baiting during the Cold War. The New England Journal of Medicine describes how proposals got attacked as made in Germany, Bolshevik, and un-American. After World War I, during the first Red Scare, opponents of compulsory health insurance associated it with Bolshevism and buried it in what they called an avalanche of anti-communist rhetoric. And you can hear the echo of those arguments today, right? Whenever we talk about making anything a public service, we hear about freedom, about individual choice, about government overreach, about socialism. The same debates about individual freedom versus collective good that played out in 1915 and 1945 and 1965. Those debates show up in education policy today. When we hear them, we talk about school choice, about privatization, about vouchers, about charter schools. So let me be clear about what I'm doing here. I'm not advocating for any particular policy position. That is not my job. What I am doing is asking implementation questions. As a teacher, I need to understand how the systems my students live within actually work, because those systems walk into my classroom every single day. So here are my questions. What does it mean for my students learning when healthcare access depends on their parents' employment status? I see the effects. I see kids who are sick and shouldn't be in school but are here anyway. I see kids who can't focus because they're dealing with untreated health issues. What's the practical impact on educational equity when one fundamental need, education, is guaranteed, but another fundamental need, healthcare, is not? How do these two different systems interact in my classroom? When a student has the right to be here, but not necessarily the health support to fully engage, what does that mean for what I can reasonably accomplish as their teacher? And here's the question that really gets me. If we had made the opposite choice, if healthcare had become the public entitlement and education had been tied to employment, what would that look like? Would we think that was okay? Would we accept a system where your kid only gets to go to school if your job offers education benefits? I'm guessing that would feel wrong to most of us. We've decided collectively that education is too important to be left to the market, that it's too fundamental to be tied to your parents' employment status. But we made the opposite decision about healthcare. And I'm not saying that decision was wrong. I'm saying we need to be honest about the consequences of that decision, especially for the students sitting in our classrooms. Because here's what I know from 25 years in the classroom. The kids who need healthcare the most are often the same kids who benefit most from education being a guaranteed right. The student whose parent lost their job and their health insurance, that kid still shows up to my class. They still have the right to learn, to participate, to access education. That safety net exists. But they might be dealing with untreated medical issues, untreated dental issues, untreated mental health issues. And there's no safety net for that unless their family qualifies for Medicaid, which has its own gaps and barriers. The COVID pandemic made these disparities brutally visible. We saw which families had access to health care and which didn't. We saw which students could see a doctor when they got sick and which students couldn't. We saw how healthcare access, or the lack of it, directly affected which students could consistently engage with their education. So that's the story of how we ended up with two completely different systems for two fundamental needs. Education took one path, healthcare took another, and both paths were shaped by specific historical moments, specific policy decisions, and specific groups protecting specific interests. The wage freeze of 1942 and that insurance exemption created our employer-based healthcare system, basically by accident. And then that accident got locked into tax policy and union negotiations and political power. Meanwhile, education became embedded as a public right starting way back in 1785 with the Land Ordinances and through state constitutions, compulsory attendance laws, and the 14th Amendment. Two different accidents of history, two different outcomes. And my students live with the results of both every single day. I don't have answers about what the right system would be. That is way above my pay grade. And honestly, it's not my job as a classroom teacher to solve these massive policy questions. But I do think it's worth understanding how we got here, because when we understand the history, we can ask better questions about whether these systems are actually serving our students well. And we can be honest about what we see in our classrooms, which is that one fundamental need is guaranteed as a right, and another fundamental need is not. And that disconnect has real consequences for real kids. That's your teacher reality check for this month. If you want to dig into this history more, I've put a full source list with links in the show notes. There's some really fascinating reading there about how these systems developed and why. Thanks for listening, and I'll see you next time. That's it for this week on If Teachers Ruled the World. Be sure to subscribe, share with a teacher friend, and join the conversation at leahcleary.com. Until next time, keep ruling your classroom and rewriting the rules.